Today I'm going to do a short video on bruising. Why do we bruise? Uh, I was at the gym a couple of days ago, and this woman, probably my age, 60 plus woman, who I think I've met before, walked up to me and asked me about bruising. She said that she tends to spontaneously bruise on her arms, and she was wondering if this was something that was dangerous to her, or whether these bruises would travel to her heart and lungs. That was her main concern. But really, she just wanted to know why she was bruising that badly. So I thought, I get asked that question quite a bit. And so it's worthwhile, just a short video on why people tend to bruise. Um, because it is fairly common, particularly in my age group or older, to have these issues. Now, if you're younger, that's a totally different deal. And I'll kind of get into that a little bit. But people my age, especially people who are exposed to a lot of sun at an early age, tend to get thinning of the skin. You tend to lose generally the fat layers, especially in your extremities. And so once that layer gets taken away and the skin gets thinner, then you tend to have veins that are more susceptible to bruising just from just minor contact, or even spontaneously just bruising or hemorrhaging. So bruises essentially blood that's outside the vessel that goes into the tissues, and you get this flush of discoloration. Sometimes you get pain with it. Sometimes it hurt when I bruise, and then that just generally dissolves with time, and that kind of tells the picture, like, this is not blood that's in your vessels. So you're not going to get this kind of stuff breaking off and go towards your heart and lungs. This is like putting blood in a sponge, which is your soft tissues and your fat. And so it spreads all over the place like a sponge does, and there's no really draining of it unless there's a congealed area of blood. It just generally bruises, spreads like a sponge, and then your body dissolves it with time. But it can take a few days to a few weeks to go away. So spontaneous bruising of the arms and the legs is the other place I see it fairly frequently. Not unusual at all. Like I said, typically in older people, I think, I may be talking off the top of my head, but, in the old days when people used to suntan with baby oil and iodine to get, that kind of the deep brown tan, I think that kind of damaged skin more often than not. So that's kind of goes to the point of using sunscreen when you're out in the sun. But bruising in the arms and legs in elderly people my age and older is not unusual at all. Now, it can be a sign of something pathologic, but unusual. If it involves your torso, then that's a little bit more of a concern. But arms and legs, not so much of a concern. And you have to. I asked her, are you taking a bunch of anti-inflammatories, like for arthritis? A lot of people take anti-inflammatories for arthritis, Celebrex, all these anti-inflammatories that people take for arthritis. Well, what does that do? That thins out your blood. So, that's one issue that you need to think about. Like, am I taking aspirin daily for whatever reason? Baby aspirin a day, and that's another talk, the evolution of aspirin therapy for heart disease. That's a different topic. But am I taking a baby aspirin a day? Am I taking a bunch of stuff for arthritis, Celebrex, or in these drugs, so-called non-steroidal anti-inflammatory drugs? They thin out your blood reversibly. So aspirin, Plavix is another drug. That's an so-called antiplatelet drug. Tyclid isn't used that much anymore. Efient, Brilinta, these drugs are all so-called antiplatelet drugs. So there's two components to the blood that are involved in clotting. The particulate component, the lumps, the actual platelets, which help with the clotting, and then there's a protein component. So there's two components to the clotting factors, to clotting cascades that can occur. So the antiplatelet agents, like Efient and all these drugs, affect the platelet component. Like aspirin is a not a reversible blocker of platelets. So in order for the aspirin effect to wear off, you have to stop taking aspirin 7 to 10 days. Of course, with the supervision of your physician who's put you on aspirin, but that's how long platelets take. That's a half-life of platelets. So, within 7 to 10 days, 50% of the platelets that you have in your body circulating are replaced by new ones. So, whereas the anti-inflammatories like Celebrex, they're reversible. So when you discontinue it, there's a reversal of that antiplatelet effect. And then there's the protein component. So the drugs that affect the protein component, if you're on warfarin, rat poison, whatever, Coumadin, same, warfarin is a generic name, Coumadin, it's a rat poison, essentially. It's hard to start it off, but it's thins out your blood. As compared to aspirin, which works on your platelets. And then there's other anti-protein component drugs like Pradaxa, Eliquis. My mom was on Eliquis for years. Xarelto. These medications act on the protein component. So are you on these medications? If you are, you can expect bruising. And sometimes cardiologists will put people on the Pradaxas and the Xareltos and a baby aspirin a day if they're concerned that the patient's a high risk for having a clotting event. So, if you're on these medications, don't be surprised if you bruise pretty easily, especially in the elderly population. So those are all the risk factors for bruising. Now, if you're bruising your torso and these other areas spontaneously, then that's a little bit more concerning, and you may need to see your primary doctor or hematologist to be, make sure there's nothing else wrong with you. Like, do you have a normal bleeding time? Bleeding time is a simple test where you just make a little scratch in your skin. You just watch how long it takes to clot or stop bleeding. You can have your ProTime check, which is a measure of your clotting factor. It's a measure of how well your protein component of your blood is clotting. ProTime, PTT, INR levels, and other lab work. You can have these specific proteins checked for that help in the coagulation cascade. Factor 5 being one of them. There's multiple ones, but a hematologist can check you for all those things and make sure you don't have a clotting problem. Now, clots, bruising in young people is a little bit of a different deal. Young kids, they're going to bash themselves and bruise. Fair enough. If you start bruising in your face, where you're not hitting yourself, torso stuff, if you're not bruising, then you start worrying about the leukemias and lymphomas. I'm not saying everybody who has a leukemia and lymphoma. It's probably just traumatic kind of bruising. But I'll tell you a story. My grandbaby, Trace, he started bruising spontaneously. It scared the living snot out of me. I thought he had leukemia. Thankfully, he had something called ITP. Really so grateful Children's Hospital in Dallas for taking care of him. They did such a fantastic job with him. They were so kind. And he's doing great. So he had a low platelet count for whatever reason, maybe a viral illness that caused it, but it scared the snot out of me. But again, so grateful to the Children's Hospital in Dallas for helping him. So anyway, if you're concerned about it, your primary care doctor can work you up. But generally speaking, don't be surprised if you bruise in your arms and legs. And then one final shout out, when I was a hematologist, talking about hematologists, when I was in medical school, there was 2 hematologists that were just outstanding. They were so smart. Don Feinstein and Sandy Levine. I still remember him to this day. I'm 62 years old. That was like 30 plus years ago. Don Feinstein, when I walked in the first day of class to his lecture, there was like 140 medical students in that class. And he would look at the class and he would say, "You, Eric Stefanian, what's the answer to this?" I'm like, I never met this guy before in my life. He had a photographic memory, I'm sure. He remembered everybody's name based on the class picture. This incredible man. professor of hematology at USC School of Medicine, and Sandy Levine, who was his associate. They were fantastic, really smart people. But to summarize, bruising, that's not that unusual, especially in the older population. And if you're taking a bunch of aspirin, Advil, Motrin, ibuprofen, non-steroidals like Celebrex, don't be surprised. Torso bruising, spontaneous, that's a slightly different deal. Kids bruising, that may be a slightly different deal. But generally speaking, these are not things that break off and go towards the heart and lungs. They're not in the circulation, so they'll resolve with time.